The average cost of a healthcare breach in 2023 reached almost $11 million. That's the average cost across all of healthcare. Think about that number for a minute. And if that doesn't tell you that there's something wrong, I'm not sure. But let me go a little bit deeper into what I mean. 92% of healthcare organizations experienced a data breach last year. One of the other scary things is that many of those healthcare organizations didn't even know it happened. And that data is out there right now. If that doesn't get you, of those 92%, 66% reported that patient care was disrupted by these cyber attacks. And it doesn't surprise me because only 38% of us actually received formal training on how to manage passwords. It's not your fault. You're not being given the education and the training that you need to be able to protect the facilities and the care that you're here to provide. Let me walk you through a couple of scenarios because I'm curious what your thoughts are. So if you experience a cyber attack and your EHR goes down and your residents end up missing their medications, is that an IT issue or is that a care issue? If you have a ransomware attack and your network gets disrupted and your residents can't communicate with their families, is that an IT disruption or a care disruption? How about this? If you have a data breach, the thing that many of us are really nervous about, and your private resident data gets targeted by cyber criminals and those cyber criminals go after them, they try to scam them, they call them, they try to steal their identity, is that a breach of data or is that a breach of care? You know, when you think about it, we all have the same systems more or less. We all use computers in our organizations. Most of us run the Windows operating system. We have some kind of antivirus. Some of us even have IT teams and security teams, compliance teams, things like that. But if that's all true, then why do we keep fighting with breaches and downtime and healthcare disruption? Why does this keep happening? Why are 92% of us suffering from these things every single year? Something obviously is wrong. If you take nothing else away from what I go through today, please take this one thing away. The greatest risks that you're facing today are not from people on the outside of your organizations trying to hack into your network. They're from the habits that you create on the inside of your organizations that make the difference. And this is where it all begins, is with your habits. I want to start by talking about how cybersecurity is really now a resident care issue. If you think back over the years, I think most people have sort of just said, hey, that's IT related. That has nothing to do with us. We hate IT. It works. It doesn't work, whatever the situation is. But the fact of the matter is, we all have VHRs. We all give out medication. We have telehealth systems. We have payroll systems, right? And we have access logs in and out of these systems, in and out of our facilities. And every single one of these systems relies on technology to function. Every single one. They're all connected to the internet. They all have vulnerabilities. And so really, we rely very heavily on cybersecurity to make sure that these systems are actually protected. And we've got all these habits that we've developed over time because we're in healthcare. Things like service, things like urgency, things like trust. Now, if you think about it, because we're in healthcare, we service our residents, right? We service patients. It's what is at the core of what it is we do. And urgency, well, this is their health. So urgency is a big issue. We are always acting in this nature of urgency. And of course, trust. The trust that we place in our employees and our staff, the trust that the families place in us as we provide the care to their family members. We've built all of these habits, and they're good habits. They're really good habits to have, but they also get us in trouble. And the reason they get us in trouble is because we haven't developed some of the other core habits that we need from a security perspective. And the proactive organizations that I work with have worked really hard at developing these habits in their organizations. Things like awareness of cybersecurity. What does that mean? How do we be more aware of the threats that are facing us today? Process. How do we handle ourselves in the event of a breach? What do we do? How do we know whether it was a breach? Having those processes down is really important. And then of course, how do we verify any of that? How do we even know? Who do we talk to? Who's the expert on this? What does that look like? What is that process? So the most proactive organizations that we work with today have built these habits on top of those core habits that we have inside of all of our communities. Now, when it comes to cybersecurity, we have a choice as it relates to the habits that we build. We, of course, can build these good habits that help to protect us, promote that healthy care, promote those care systems, or of course, we can develop bad habits. And most of those come from us being reactive because we never prepared. We were never proactive with any of the decisions that we made around some of these things. And I get it, it's hard. It's hard. Our focus is the resident. Our focus is the patient. Our focus is making sure that they're okay and they're getting what they need. But when we don't stop for a moment to think about some of these things, it gets us in a lot of trouble. That's why 92% of us have suffered one of these cyber breaches in the last year. These reactive habits are dangerous, and it comes from the fact that we are not prepared. And that's really what it's all about. It's about the proactive habits that we build today. Because those habits, they're what create the culture in our organization. When we have a culture of security, when we have a culture of awareness, it helps us immensely to protect what it is we're here to do.